Welcome to Ask Dr. Tom. We connect with Dr. Tom to talk about all things health and wellness, cancer treatment, etc. This is Ask Dr. Tom with Dr. Thomas Incledon. He's the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. From working with NFL, MLB, MMA, world-class athletes, and even the White House, Dr. Tom's reputation of personalized medicine and cutting-edge technologies have put him on the map for caring for some of the most powerful people in the world, making him one of the most sought-after healthcare professionals of our time. So another topic that we'd like to dive into is gallbladder cancer. Now, some of these topics, when it comes to breast cancer, obviously, and prostate cancer, they have a predisposition to be gender-oriented. So gallbladder cancer, I would imagine, correct me if I'm wrong, might favor men, but there is obviously a potential for women and men both to get gallbladder cancer. Is that right?
Yeah, so both men and women can get gallbladder cancer, but it's more likely in women than in men. Yeah, so it's there's some interesting observations, and one is that gallstones are very common, yet gallbladder is not common. So that's two, but gallstones are linked to gallbladder cancer. So see how it's got all these random data bits that's like, huh? So there's, one of the things I'll share with gallbladder cancer is it's less than 20,000 cases per year. Age range is 19 to 60. It's tough to find if you have gallbladder cancer, generally speaking, because most people don't usually know it until their skin starts turning yellow, and then they're like, "Hey, what's going on here?" So it's not a common one, but it's an interesting one from the perspective of there's a lot of findings that are somehow connected, but we don't understand all the relationships.
I was surprised, obviously, because I supposed that it was probably going to be leading in males that would have a higher risk of gallbladder cancer. Shows you what I know, and it's a good thing we asked Dr. Tom. So you're saying, Dr. Tom, that it's a higher instance in women. Is there a reason for that? Is there something about the human female body versus the male body that makes them more susceptible? We both have gallbladders.
Yeah, so it's not really clear right now why women get it more. I mean, there's, we know obesity has a factor, and women tend to have a higher body fat. It's not so clear yet, if there's like a hormone reason or some other reason for that. Like generally speaking, I would have kind of agreed with you that, I think men abuse their digestive tract more than women as a general statement. And because of that, I would say, there's more likelihood for problems with the gallbladder and the liver and other, organs around that part of the body. And then lo and behold, that's not true. As far as women seem to be 3 to 4 times more likely to get it. There's not a clear answer at this point.
This is the Ask Dr. Tom show, where we ask Dr. Tom questions about some of the most frightening cancers that are out there. And some of them, like gallbladder cancer, are not as common as you think. But what helps is to get the right information from a good source. So rather than ask Dr. Google or WebMD, we effort to ask Dr. Tom. If you have a question for Dr. Tom, you can submit it at askdrtom.com, or you can text the word health to 72000 if you're in the U.S. and Canada. What are the reasons that gallbladder cancer occurs 3 to 4 times more frequently in women?
So, that's kind of along the lines of what we were talking about a little bit ago, and that it's not really clear. I mean, it's we think there's clearly differences between men and women, right? But it's like when you control for some of those things, it doesn't connect the dots, so to speak. So right now, it's unclear why women are more likely to get it. So there's not an easy answer for that.
How are the resectable and non-resectable gallbladder cancers different? So first off, I would have to ask, what is the difference between resectable and non-resectable? What does that mean?
So resectable means that you can do a surgery to remove the cancer. So let's just say it's in one spot hasn't spread anywhere. So you get some type of gastric surgeon or some sort of surgical oncologist or somebody with surgical expertise. They could look at some imaging and say, okay, look, it's right here. I could go in and remove it this way. Non-resectable or unresectable gallbladder cancer is when it's kind of spread around the area. It's now in the blood. It's now going into other organs, so it's not like one spot to remove, if you will. So it's just, surgery is not a good option in that case. So the difference between resectable and non-resectable is, can you do surgery or not to treat that or to help, fight that cancer?
So when it comes to the version that you can't operate or can't, do you treat those differently? You must.
Yeah. So an example of the different strategies might be something like this. So for resectable gallbladder cancer, you might do surgery and then follow up with some sort of strategy to kill cancer cells in circulation. So that way you minimize the likelihood of something regrowing later on. With non-resectable gallbladder cancer, there may not be any surgical intervention because it's spread too much. So you may have to look at, some sort of strategy involving, let's say, chemotherapy, some natural substances, diet modifications, to see then how the body responds, and then, kind of follow up some more with the right options there.
When you start Googling around and looking around, we're talking with Dr. Tom. This is the Ask Dr. Tom show, and the topic is gallbladder cancer. But Dr. Tom has already shared that gallstones lead to gallbladder cancer, or can lead to gallbladder cancer. If you go and you look on the internet, you're going to see I've seen all sorts of videos about these cleanses that people are doing to get rid of gallstones, where they're taking all sorts of different things and ingesting them for a certain amount of days. Does getting rid of gallstones reduce your risk of gall cancer if you're doing that on your own and you're doing these cleanses?
So, okay. So there's a relationship between, so when I look at people that have gallbladder cancer, they tend to have gallstones. So you would say, hey, gallstones are somehow involved in gallbladder cancer. But when you look at how many people get gallstones and then the incidence of gallbladder cancer, those two metrics don't connect really well. So it appears that gallstones are linked to gallbladder cancer, but we're not exactly sure how. One of the things we do know is that when there's inflammation in the body, there's increased calcification, meaning the body deposits more calcium in that area. So it's possible that for some people, they have some inflammation, gallstones get formed, and it keeps progressing to cancer because the inflammation never gets controlled. And in other people, the gallstones get formed, and then maybe they get the inflammation under control, so they're there, they didn't break them down, but it doesn't progress to cancer. So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is the standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So where someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to Causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.